Welcome to the Weekly Dose, a Pharmacy Times broadcast bringing you the latest clinical updates, regulatory decisions, and expert insights shaping the pharmacy profession. I'm Danielle Valetti, and today I'm joined by Kennedy Ferrugia.
Each week, we break down the top stories impacting pharmacists across specialties, from clinical practice and emerging therapies to regulatory updates and patient care. Let's begin with this week's top story.
Our top story this week looks at something many patients ask about every day: coffee. A new scientific statement from the American Heart Association concludes that for most adults, drinking up to 400 milligrams of caffeine per day, or about 5 8-ounce cups of black coffee, is safe and may even provide cardiovascular benefits. The report, published in Circulation, also gives pharmacists new evidence to help counsel patients about caffeine consumption.
The writing committee found that regular coffee consumption was associated with a lower risk of type 2 diabetes, heart disease, stroke, heart failure, and some heart rhythm disorders. In fact, drinking about 2 to 4 cups of coffee per day was linked to the greatest cardiovascular benefit. The authors also note that, contrary to long-standing beliefs, moderate caffeine consumption does not appear to increase the risk of atrial fibrillation, the most common heart rhythm disorder.
Gregory Marcus, MD, chair of the writing group, told Pharmacy Times that people who enjoy coffee or tea should be reassured that these beverages are almost certainly not harmful to their heart and may actually offer cardiovascular benefits. At the same time, he emphasized that caffeine isn't one size fits all. Age, genetics, medications, and underlying health conditions can all influence how a person responds to caffeine. He added that patients experiencing palpitations, premature ventricular contractions, or insomnia may benefit from reducing their caffeine intake.
The report also makes an important distinction between coffee and energy products. While moderate coffee consumption was generally associated with positive heart health outcomes, energy drinks and energy shots were linked to higher risk of high blood pressure, arrhythmias, and even serious cardiac events, particularly in younger adults. That's because these products often contain much higher concentrations of caffeine, along with other ingredients that may increase its effects.
The authors also point out that how coffee is prepared matters. Unfiltered coffees, such as French press, espresso, and Turkish coffee, contain higher levels of compounds that may raise LDL cholesterol, while added sugars, syrups, and creamers may reduce many of coffee's potential health benefits.
For pharmacists, the message is to take an individualized approach. Caffeine doesn't just come from coffee, it's also found in tea, soda, chocolate, energy products, and even some of the over-the-counter prescription medications. Marcus also recommended that patients taking their stimulant medications, such as those to treat ADHD, be cautioned about excess caffeine consumption. For this week's FAQ feature, we're looking at how pharmacists can help protect patients with asthma, COPD, and allergies during wildfire smoke events. The FAQ is fact-checked by Paul Solinsky, PharmD, and highlights why wildfire smoke is now a clinical concern well beyond the western United States.
The most dangerous component of wildfire smoke is fine particulate matter, or PM 2.5. These particles are small enough to travel deep into the lungs, where they can trigger inflammation, impair gas exchange, and even enter the bloodstream. Patients at the greatest risk include those with asthma, COPD, allergic airway disease, or cardiovascular conditions, as well as children, older adults, pregnant individuals, and those without reliable access to air filtration.
For patients with asthma, smoke can trigger air inflammation, bronchospasm, increase mucus, and reduce peak flow. In patients with COPD, exposure can worsen oxidative stress and increase the risk of exacerbations, hospitalization, and respiratory failure. Smoke can also irritate the nasal and bronchial passages of patients with allergies, especially when pollen levels are also high.
Pharmacists should encourage patients to keep both controller medications and rescue inhalers readily available during poor air quality events. They may also need to help facilitate early refills if patients are using rescue medications more frequently than usual. Patients who appear to be relying on rescue therapy alone should be flagged for follow-up, since current asthma guidelines recommend controller-based treatment rather than rescue-only regimens.
Counseling should also include practical exposure reduction steps. Patients should monitor local air quality, stay indoors with windows and doors closed when conditions are unhealthy, and use an air purifier when possible. Those who must go outside should wear a well-fitted N95 or KN95 respirator, since standard surgical masks do not effectively filter PM 2.5. Pharmacists should also review inhaler techniques, since respiratory distress can make medication use more difficult.
We're rounding out this week with two important regulatory updates involving obstructive sleep apnea and ROS1 positive lung cancer.
First, the FDA has accepted the new drug application for AD109, an investigational once-daily oral treatment for adults with obstructive sleep apnea. If approved, it could become the first pharmacologic treatment designed to address the neuromuscular cause of upper airway collapse while improving oxygenation during sleep. The FDA has set a target action date of February 28, 2027.
The application is supported by the Phase 3 Lunaro and Synergy trials, which evaluated AD109 in adults with mild, moderate, and severe obstructive sleep apnea. In Lunaro, AD109 reduced the apnea-hypnea index by approximately 47% at week 26 compared with about 7% for placebo, with benefits maintained through 51 weeks. The treatment also improved measures of oxygen desaturation and hypoxic burden. AD109 was generally well tolerated, although common adverse events included dry mouth, insomnia, nausea, and urinary hesitation.
Next, the FDA has approved Jadetro for adults with locally advanced or metastatic ROS1 positive non-small cell lung cancer who have previously received a ROS1 tyrosine kinase inhibitor. The next generation ROS1 inhibitor was designed to target resistant mutations and cross the blood-brain barrier, which may make it particularly relevant for patients with central nervous system metastasis.
The approval was based on results from the Phase 1 and 2 AROS-1 trial. Among 117 evaluable patients, the objective response rate was 44%, with 69% of responses lasting at least 12 months. Among patients with measurable brain metastasis, the intracranial response rate was 48%. The most common adverse reactions included edema, peripheral neuropathy, constipation, fatigue, and dyspnea.
For pharmacists, this approval adds another precision oncology option for patients whose disease has progressed following prior post-targeted therapy. Counseling should emphasize adherence, possible drug interactions, and early reporting of fluid retention, neuropathy, or respiratory symptoms. This week's stories highlight how pharmacists help patients navigate everyday health questions, environmental risks, and a rapidly evolving treatment landscape.
From counseling patients on safe caffeine consumption and protecting those with respiratory conditions during wildfire smoke events to new developments in obstructive sleep apnea and ROS1 positive lung cancer, pharmacists continue to play a critical role in patient education, medication safety, and clinical care. You can read more about today's stories on pharmacytimes.com and be sure to follow us on social media at PharmacyTimes. For Pharmacy Times, I'm Danielle Valetti.
And I'm Kennedy Ferrugia. Thank you for watching the Weekly Dose. We'll see you next week.